Straight now to Enugu in Nigeria's southwest, where Nkiruka Ajogu is standing by with the update on COVID-19 efforts in that state this evening.
The state government is scaling up the enforcement level of the restrictions and guidelines earlier issued to contain the spread of coronavirus in the state. The government had on the 28th of March confirmed 2 cases of coronavirus. They are both a man and his wife who are returning travelers from the UK. So the governor was out today with security operatives to monitor the compliance level and the disinfection of all the markets in the state. So for people who have no business being in the markets, especially those who don't sell food items, who don't sell pharmaceutical items, who don't sell water and other basic life essentials, they were encouraged to stay home until it's safe for them to come out. The governor and his team were also at the State Diagnostic Center, which has been mapped out for the treatment of COVID-19. Should there be an escalation, he also visited another isolation center in Nsukka, which has been mapped out to handle any case of coronavirus that comes up in that area. Because in Nsukka to Enugu, it's about 45 minutes. So if there is any case in Nsukka, which is also another city, it will also be handled immediately. So we'll be here to bring you up to speed with happenings in the states. From the government house, Enugu, Nkiruka Ajogu.
Thank you very much, Nkiruka from Enugu in Enugu State. Now, Dr. Oluwole, you've seen what's happening in some of the states, basically locking down, really. Now, if you, before we took the break and took those updates, you were giving us some level of an explanation as to why you thought that it might still be early to determine the impact of these various measures on the various places. Can you conclude that thought now?
Yes. Like I was saying, series of activities are going alongside the lockdown. So, for instance, in Lagos, we're having health officials who are into contract tracing, now going house to house, okay, asking, of course, at a distance, whether anyone has any symptoms.
Of the symptoms.
Yes. And that is, I think, what is going to be the benefit of this stay at home. So, and of course, if you look at the graphics and at the numbers of where we're having a lot of cases in Lagos, you know that the Honorable Commissioner had pointed out some local governments. Yes. So efforts are in those areas to go on. Of course, we know that our contract tracing is going up, but also to go house to house, and that's what's going to be the benefit of this, so that anyone who possibly have symptoms at that time, you know, could be taken, have them tested, okay, and then possibly take them in for treatment as soon as possible. Alongside that is also opening up of more testing centers, and isolation centers are opening up around the states, okay?
So these testing centers, yes, you mentioned them earlier. You said, yes, there are now 3.
Added to
the ones that were, which are these new 3?
I know that there's a Boeing that has just been set up, and I know government is trying to set up one in not two states, but I can't figure out
which ones
which
yet.
one.
As
yes,
yet.
But I know that.
But in Lagos, we have 3 principal testing centers.
Yes.
The Infectious Diseases Hospital in Yaba, the Institute of Medical Research, and
in the
Lagos University Teaching Hospital.
Yes.
Can people just go there?
No. So there are those guidelines as to who, you know, can
qualifies,
get tested. Yes, have been outlined by the NCDC and the state government. And that's why at this point where people are at home, it's advised that if you have any symptoms, you call into those numbers, designated hotlines, and then there's a review of what symptoms you've had, and if it fits into the checklist and what we consider as what will be due for a suspect case, they go to take samples and then, you know, process that quite fast, and then all the other process of taking into treatment commence immediately. So those are the things that we still have, and I think that is quite, good for where we are, when people are able to communicate that alongside what I mentioned before, house to house, asking people if they probably have symptoms.
Now, I want you to look ahead. Now, I mean,
Yeah.
we spent quite a bit of time looking at where we are.
Yeah.
Now, what, in your view, needs additionally to be done for us to be able to prevent us getting to that precipice of community spread? What else? I mean, we are doing lockdown with mixed results.
Yeah.
We're doing contact tracing. You pointed out there's obviously more testing being done. What else?
Yes, I think, we need to look at the numbers and see how we are doing. Like there's no one size fits all that will go across boards. And I mean, we can't say what the Americans are doing, is what we are supposed to be doing. We need to look at effectiveness, and efficacy of our interventions to say that, okay, this is where we need to go. Of course, we've identified one or two cases, suspected cases, where we didn't actually lay our hands on history of contacts with these persons. And so, health workers and people in charge are also looking at the possibilities of having community transmission going on at the moment. So all these other strategies are going to be in the days to come, are going to come up, in terms of intensifying our contact tracing, intensifying, providing places. I know that the Lagos University Teaching Hospital is already setting up over 100-bed facility now.
Yes.
So treatment areas need to be ready and proactive because there could be a surge. And that surge can only come from the testing that we're able to do. So we're adding more testing centers. We're able to expand, our testing areas, have isolation areas, and then bring people up to treat as much as possible. So identification is not just for individuals again, but also for planning. So if you're able to identify, we're able to say and look at the results that we have and look back at what possibly might have happened in terms of infectivity, how this person has contacted, who has been, and then round up all those group of people. And in pockets like that, even as we go on, and even as the numbers go on, yes.
All right, Doc. Let me again put you on pause and take a look at other stories now outside our shores, what's happening elsewhere. The United Arab Emirates government is doubling its efforts to fight COVID-19 pandemic, but the closure of all its airports has affected the importation of food items, including from Nigeria. Food vendors from Nigeria lament the slowdown of business, and in some cases, there's a shutdown of restaurants. Our correspondent in Dubai, Mayowa Adegoke, now reports.
The measures and rules implemented by the UAE government to tackle the rising number of COVID-19 cases become more stringent, and for good reason. Recently, government has had to shut down the entire private sector, airports are closed, malls as well as open markets, a decision which is now impacting Nigerian food vendors in different ways. Located in the heart of the once busy financial district, Pan-African restaurant Kiza observes its last day of business until the health situation in the city of Dubai improves. Silence, empty chairs and tables now replace the liveliness that once attracted Nigerian tourists and residents seeking local dishes and entertainment. Most are now at home practicing social distancing.
No, it's not about the business anymore. It's about our people internally and the general community as a whole. If this virus is getting so deadly in the way that it is spreading from communities to communities and from persons to persons, we just thought it right that for the safety of all our in-house employees and the general community as a whole, to just shut down.
19 kilometers away in another part of town,
Biggest restaurant remains open, with a few customers making bulk orders. However, concerns are growing about the dwindling food stock.
Half of what we are cooking here coming from Africa. So like, we don't have pepper, we don't have a lot of things that come from Africa now. We didn't get it easily because it's coming through airport.
Many customers depend on restaurant services for their daily meals and hope the businesses keep running.
We feel there should be some exceptions, especially in the food area, so that people like us will be able to feed and survive in this corona issue.
Other Nigerian food vendors, such as this store, are also running out of supplies as buying patterns change.
In next 2 or 3 weeks now, or highest 1 month, at least our stock will finish. So we are only praying to God to help us to calm the situation down.
We're using this time to see how we can give our customers a better version of ourselves. So, we're just trying to take some positives from this situation.
Well, with Nigerian food vendors running out of supplies, Nigerians partial to local dishes may have to depend on foreign delicacies for sustenance. From Dubai in the United Arab Emirates, Maya Wadegoke for Channels Television News.
We'll take a break at this point. When we return, we'll listen to Prince Charles of Britain, who couldn't be more grateful to have survived the COVID-19 pandemic. Thanks for staying tuned. Britain's Prince Charles couldn't be more grateful. He has survived the coronavirus disease, having tested positive last week. In a video posted on social media, the Prince praised the selfless devotion of healthcare workers, saying it was a strange and distressing time for the nation.
We have recently gone through the process of contracting this coronavirus, luckily with relatively mild symptoms. And I find myself on the other side of the illness, but still in no less a state of social distance and general isolation. As we're all learning, this is a strange, frustrating and often distressing experience when the presence of family and friends is no longer possible, and the normal structures of life are suddenly removed. At such an unprecedented and anxious time in all our lives, my wife and I are thinking particularly of all those who have lost their loved ones in such very difficult and abnormal circumstances, and of those having to endure sickness, isolation, and loneliness. As patron of Age UK and my wife the patron of Silverline, our hearts go out to all those older people throughout this country who are now experiencing great difficulty. However, we also know that in every community up and down this land, where people of all ages are being affected by this virus, there are truly wonderful neighbours, individuals and groups of volunteers who are providing ceaseless care and attention to those most at risk, and that all this network of selfless assistance is in itself helping to provide vital support and reassurance to the hard-pressed professional services.
Meanwhile, other places in the world are also continuing to battle with the COVID-19 outbreak. The Johns Hopkins University says the United States now has more than 200,000 confirmed cases of the virus, the highest number in the world, followed by Italy, which has over 100,000 cases. Spain today recorded the highest one-day death toll of 864, as deaths across Europe go beyond 30,000.
Spain has recorded another 864 deaths related to coronavirus, the highest in one day, as the total number of deaths across Europe goes beyond 30,000. More than 9,000 people have died in Spain, which is second only to Italy in fatalities caused by the virus. Confirmed cases in the country have passed 100,000, but numbers show the infection rate continues to fall. Meanwhile, United Nations Chief Antonio Guterres says the coronavirus pandemic is the most challenging crisis since World War II.
The combination of the two facts and the risk that it contributes to enhanced instability, enhanced unrest, and enhanced conflict are things that make us believe that this is indeed the most challenging crisis we have faced since the Second World War.
The UK says the number of patients who have died has risen by 563 since Tuesday to 2,352. The government says 29,474 people had tested positive for the coronavirus, up 4,324 since Tuesday. Meanwhile, the All England club confirms that the Wimbledon has been cancelled for the first time since World War II because of the coronavirus pandemic.
2, 1.
On a lighter note, you can always count on a superhero when times are hard. This British Spider-Man runs the streets of Stockport to cheer children in the coronavirus lockdown. The superhero is doing his bit to make sure that they're entertained while they're indoors. Two buddies working separately have been visiting streets around Stockport, waving to children and putting smiles on their faces.
Alex, can you just twist that back towards me a little bit more? That's great.
Always a silver lining in every dark cloud. Now, Doc, our final moments. Now looking ahead, if you are going to take a look ahead now, what do you expect to see? What's your projection over the next couple of days?
I think we should be hopeful. We should be positive. We should be optimistic about, but also be realistic about possibilities that we might be facing. Okay, so there's been numbers that have been projected that we might have. I think what we need right now is to prepare. Training and retraining of health workers, doctors, nurses, hygienists all over the country. And I can see other states who have not had any case are also preparing ahead, setting up centers for treatment. I think that's very important when cases begin to pop up. So we need to have trained staff who are ready, motivated, trained staff who are ready to go and who are ready to attend to patients. We don't want to get people tested, make positive, and then we lose them. So we need to have all hands must be on deck, and support from the private sector, which is pouring in now, and then a concerted effort, generally as the government, and also from the people in defeating the virus.
Thank you very much, Dr. Ayo Oluwole, has been our guest tonight. It's been a pleasure having you with us.
Pleasure having me.
And that's our COVID-19 special edition on Channels Television tonight. We thank you for watching. Please join us again at noon, 6 and 9 p.m. tomorrow. We'd like to hear from you about this lockdown period. If you're in Lagos and Abuja, tweet at us at Channels TV. I'm Ladi Akere Duluali. Bye for now.